there, it's Dr. Megan from Balance Within PT. So I often get the question of what makes you guys different from going to a standard PT clinic for postpartum care? Why should I come here? What can you offer that's different? So the biggest thing I think we have on our to our favor here is we have time to really listen to know you, to know your story. We're not limited by what insurance or policies say that we can cover. Oftentimes, postpartum care is limited only if you have pain or if you have incontinence. But maybe you just want to get your abdominals back. Maybe you have an abdominal separation, maybe, but you're not sure. Maybe you just want to feel strong and feel good again and be able to pick up your kids without limitations and feeling like you can get back to the exercise you want to. Fortunately, that's not usually covered by in-network care. And even things like pelvic pain and incontinence are limited with their coverage. Some insurance companies only cover a few visits and some are more generous with it. But one thing you'll get at Balance Within is we're going to really zoom out to look at you. What can happen sometimes is you get a really narrow view of just looking at your pelvic floor or just looking at your back. And we do a really good job of, okay, we want to look at those things, we want to look full picture. I want to know why your pelvic floor is tight to begin with. Is it because your pelvis is maybe out of alignment? Is it because you're overusing your neck when you go to pick up your kids and that's contributing to the pelvic floor tension? So we want to look at that root cause and solving all those different components, pieces of the puzzles to get you to your specific goals. Unfortunately, insurance kind of dictates what goals that are allowed to create. So your goal might be, I want to get back to CrossFit. I want to do a marathon, but insurance doesn't really care if you can do that. They maybe will pay for you to be good enough, so maybe 60% better. But we want to get you 100% better and back to where your goals are. I think the experience that we have here of looking at that whole body approach, I have the orthopedic background, the pelvic floor background, and a postpartum corrective exercise background. So merging those three things together can be really helpful to really look at that big picture component to things. So biggest thing is that we take the time to listen to your story. We're going to zoom in and zoom out to look full picture, root cause. Let's look at all the different little steps to help prevent things from getting worse and to help you feeling better now. I talk to so many women that I see 20, 30 years after having kids and they say, I wish I knew about this sooner. And at 30 years later of leaving some of these things unaddressed, maybe their incontinence is bad enough that surgery is on the table. Maybe they're having hip injections because they're having so much pain because they don't have that pelvic stability for the last 30 years. Maybe they developed a prolapse because their body had different strategies that they used because they didn't learn correctly how to manage pressure as a newly postpartum mom. So lots of things that can be prevented. So I strongly encourage you, if you know of anyone who's just had a baby or you've just had a baby, get in to see us. I'm happy to answer any questions, do a free discovery consultation with you, and see if you would be a good fit, if we'd be a good fit for you. But definitely don't delay it. It can really help out with a lot of things and prevent a lot of issues down the road as well too. So come check out our website at balancewithinpt.com to learn more or give us a call. Thank you.